My name is Dr. Michael Snyder. I practice at Cambridge Dental Associates in Greenwood, South Carolina. So I grew up in Anderson, South Carolina, which is about an hour north of here. Most of my family is from that area. I went to Clemson, and then after graduating Clemson, went to dental school in Charleston at the Medical University of South Carolina. I relocated to Greenwood in 2009 to begin practicing and have been in this town ever since. I think a new patient coming to our practice is probably going to be surprised maybe what their first appointment with us is like. I hear all the time about how they've never had an appointment like they have here. And we schedule enough time to not just jump right into maybe a cleaning. We want to sit and talk to our patients and tell them about what's going on. And I've always focused on not only educating my team here, but also educating the patients. We want the patients to be a part of their treatment. We don't want to just be telling them what they need and they don't really understand why. That's always been a big part of Cambridge, is to say not only what you need, but understanding why you need it, and then being on the same page of how we go forward with the treatment. At Cambridge Dental, we consider ourselves a comprehensive dental practice. We do see all ages, from kids to our geriatric order patients, and we do basically anything you could think of in terms of general dentistry. We do crowns, and we do veneers, and we do cosmetic dentistry. We also do clear aligners. We do basic cleanings and just regular checkups and things like that. We want to be the type of dental practice that you can come to, that you can get everything you need to done and have it done well without having to be referred to 4 or 5 different practices. So in our practice, one of the biggest pieces of technology that we use every day is called CEREC. And CEREC is a piece of machinery that allows me to design crowns, bridges, other restorations, same day for patients. Historically, that would be something that the patient would come in, they would be numb, they would have the work done, an impression would be done, they're gagging, a temporary goes in, and then they come back and see me 2 or 3 weeks later for the permanent restoration to go on. And our practice is a little different. They come in and they're anesthetized, still the same, and we're still preparing the tooth in a traditional manner, but then we're using a computer and a CAD/CAM system to design the crown while they wait. No longer are they taking 2 days off work or having to come back for a second appointment or worry about a temporary coming off on the weekend when no one's available. Instead, the permanent one goes on the same day. What I want here is I want patients to understand that we're just involved with their care as they are. They've sought us out and we respect their time for doing so, and we want to take the time appropriate with them. They're not going to be rushed in and out of here. Their appointments are going to be the appropriate amount of time, and they're always going to be involved in every step along the way of whatever care there is that they're receiving here. And I like being able to interact with my patients. I like seeing them at the grocery store or at church or just out. Or my kids may go running up and say hello because we see so many people all the time. And I think that's the really unique thing about Greenwood. And I probably couldn't work the way I do in other towns. Taking care of my patients, spending extra time with them. I may be in a larger city, more rushed for time, but here we can really focus on the patient care, which again is first and foremost to everyone at the practice.